My aim after surgery is to deliver cold to the site as well as some compression, and with the PhysioLab device it can offer both. There are other devices out there offer similar type of compression and similar cold, but the reason that I'm more into the PhysioLab device is because it is very robust, and also we can transport it from one place to another easily. It is a closed system within the cuffs itself, and it gives a really good constant pressure, and it will give a good feedback on the monitoring, so we know what sort of pressure, what sort of temperature we've been delivering to the patient, and we can monitor that very easily. Currently, I use PhysioLab device on post-operative patient, especially on knee replacement, revision knee surgery, high tibia osteotomy, ACL reconstruction, as well as cell therapies. So within those surgery, there will be a lot of trauma going around the knee, and with the coolant and the compression, it really reduces that swelling a lot. At the same time, it will also reduce the pain. Opiate is a very powerful painkiller. However, it is very addictive, and also it makes the patient feel doesn't make them feel very well. And at the same time, if the patient don't feel very well, they feel sick, they will not want to get up and do the exercise and do the rehabilitation. So after surgery, if we can use less opiate, it will have happier patient because they don't feel as sick. You will have happier staff because they don't have to keep getting called to administer the painkillers. And then you will have better, physiotherapy be happier, be able to do their job, they're able to mobilize that joint, and ultimately the patient will benefit. Because they will be able to get themselves discharged quicker if the wound is no longer painful, if they're able to function, if they're able to walk up and down the stairs. Within all those, the journey of patients that stay in hospital probably becomes shortened. So of course it's beneficial to the patient, the surgeon, as well as the hospital. So after surgery, when I use the PhysioLab on some of my patients, especially on the knees, it really reduces swelling, reduces edema. I would say at least 50 to 80%, and that effect is very, very apparent. Usually the next day I get a phone call from the physiotherapy and they say, wow, this knee doesn't swell, and we can actually really work on it. And I think that is the very big features on how it can actually reduce the swelling and reduce edema. Anecdotally, we had two patients that was trying on this with the S1. One of them didn't want it to start off in the beginning. The other one, had a go at the very beginning. And overnight, the result is very apparent. The patient that with the S1 did not ask for any painkiller at all. Didn't have any opiate painkillers. So, but on the other side, patient asked for painkillers a few times. They have used the patient control PCA, the patient control administration machine, to have morphine. And then the next morning, the other patient asked for the machine, and then since then he stopped using his painkillers. So to me, anecdotally, I think the effect is huge.